are part of the country's new industrial strength, you who are working in factories or in shops, your first job perhaps, and one in which you are meeting new people and new problems every day. It is the concern of you who are working in offices, whether as executive or stenographer. Canada's a young country, and to her young citizens she offers tremendous opportunities for success. Opportunities to make your life what you want it to be, to choose a job you like, and to find interesting things to do in the hours after work. When you leave the office in the afternoon, most of you can afford to plan trips, go to a concert, or buy a new dress for a special date. But many of you may never have a chance to enjoy all these good things of life because VD strikes most often at people between the ages of 16 and 26. A modern woman has an almost unlimited choice of interesting careers. If she's energy, she can hold any good position in business or the arts until the day when she leaves work to marry. Even the gayest bride must feel a little solemn on her wedding day, must feel the beginning of a new sense of responsibility toward her husband and toward the children she'll have. Her own health has an immense effect on the health of her family. School, job, marriage. This is the story of 9 out of 10 Canadian girls between the ages of 16 and 26 years. Yet, it is in these 10 years, more than in any other equal period, that women are struck with venereal disease that threatens their whole life's happiness. Here is a comparison between VD and other communicable diseases. In 1 year, only about 200 cases of infantile paralysis occurred in Canada. Water purification kept typhoid to less than 1,000. Diphtheria attacked 2,800 people. Tuberculosis accounted for over 12,000 tragic new cases. Scarlet fever found over 18,500 victims. These communicable diseases totaled 35,225 new cases. VD outstrips them all. VD infects more than all others combined. 40,000 people who are a menace to themselves and to others around them. About 1 person out of 20 has venereal disease, and 75% of all those who are infected are under 30. All young women should understand the problem of venereal disease because it leads to the tragedy of lives shadowed by illness and the despair of knowing that you may never bear children like other happier women. Gonorrhea and syphilis are caused by rapidly spreading germs. If you looked at them through the microscope, they would appear something like this. Here is the gonococcus germ, the beginning of gonorrhea. And here is the other enemy, the spirochete of syphilis. These germs usually invade the body through the sex organs. To understand the danger of acquiring venereal disease by intercourse with an infected person, you should know something about these organs. The passage between the outside of the body and womb is called the vagina. The neck of the womb projects into the upper part of the vagina. The womb, or uterus, is the organ where the child develops. The tubes and ovaries lie on each side of the uterus. In this side view, you can see the vagina, the uterus, one tube, and one ovary. These organs are all vitally concerned with childbirth. In addition, you can see the bladder and the urinary passage, which lie in front of the sex organs. Now let's see the effect on these organs of the first venereal disease, gonorrhea. Gonorrhea is usually acquired through sexual intercourse with an infected person. When a woman contracts gonorrhea, the infection usually starts at the opening of the urinary passage and around the neck of the womb. These become inflamed, causing discomfort and usually a burning sensation on passing water. Soon there's soreness at the outlet of the vagina and a discharge of pus. The infection spreads to the inside of the neck of the womb. If treatment is neglected, the disease invades the inner wall of the uterus and enters the tubes. They become filled with pus. It is here that the ova or human eggs are formed, and damage which will interfere with having children can be done to these organs. You know now that gonorrhea is a contagious disease, that it is spread through sexual intercourse with an infected person, that it affects the sexual organs, that if it is not treated, it will progress and cause serious illness. These things are important. Remember that once these organs have been damaged, they may never return to normal, and that a woman who has been severely damaged with gonorrhea may never have children. Start treatment as soon as you know that you are infected, and keep it up until you have been cured of the disease. Here again is what your second enemy looks like. It's the spirochete, the germ of syphilis. Like gonorrhea, syphilis is generally acquired through sexual intercourse with an infected person. The germs usually enter the body at some point on the sex organs. They get right into the bloodstream, and a week or so later, a small sore appears at the place where they first entered. As this sore is painless and often hidden from sight, it may easily go unnoticed. In any event, it soon disappears, even without treatment. In the meantime, however, the germs have multiplied, and the whole body has become infected. At this stage of the disease, skin rashes occur. The patient may have a sore throat, or chancres will appear in the mouth and tongue. These various symptoms, skin rash, sore throat, patchy hair, and so on, may be severe or so slight that they are not noticed. Nevertheless, at this time, the germs have spread through the body, and you have a severe infection, whether you know it or not. In this stage, the disease may cause no trouble for years, but it is a constant threat to mental and physical health. From the primary infection at the sex organs, the circulation of the blood has carried the seeds of syphilis to many parts of the body, the liver and stomach, the bones and joints, to the heart, the lungs, eyes and ears, to the brain or nerves. Because of the hidden nature of syphilis, a couple planning marriage should always have a blood test taken in case they have contracted the disease without knowing it. It's important to their happiness that they start life together confident of each other's health. Because if a mother is infected, then the child will become infected. It may be born deformed or deficient in some way. and very commonly it will be born dead. But if the disease is detected as late as the 5th month of pregnancy and treatment is started, then the child can be saved and born totally free of the disease and its effects. Remember, treat early and it will be a healthy baby. In fact, all the serious results of syphilis may be avoided if diagnosis is made during the early stages and proper treatment given. If this is done during the first 6 months, cure is almost certain. After that, syphilis is difficult to cure and will require prolonged treatment. If there is the slightest chance that you have been exposed to infection, have a blood test. This will show whether or not you have contracted syphilis. It's a very simple procedure and well worthwhile. How often do you prick your finger when you're darning? A blood test is scarcely any more painful than that, but it's good insurance against such tragic results of neglect as paralysis, permanent scars, blindness, mental illness, treatment consists of injections which take only a few minutes and cause no inconvenience, but they must be continued until the disease is cured. That may take weeks or months, but persistence will mean freedom from the disease. All doctors are sworn to give the strictest confidence to their patients' condition. At the VD clinics throughout the country, where free treatment is gladly given, there's always a sincere respect for the privacy of the individual. The patient's records are kept separate from all other documents in locked filing cabinets. If you keep yourself as safely put away as these medical papers, the dangers of contracting the disease would be slight. But the business of living brings you in touch with all sorts of temptations. There are times when you feel lonely and tempted to play along with a casual pickup. Don't do it. These men are often infected. Fits of depression or disappointment sometimes make you take too much to drink, hoping that the resulting loss of inhibitions will make you a gayer, more popular person. Seeking escape this way is dangerous. Alcohol not only makes you look like a fool, it makes you foolishly careless. With your normal sexual emotions greatly heightened by liquor, it's very easy to expose yourself to infection. One gay evening will not pay for years of illness. I think all of you know how important a healthy body is for success, and that knowledge is one of the greatest weapons in the fight against disease. Let us go over the 7 points to be remembered about gonorrhea and syphilis. Venereal disease is usually acquired by sexual intercourse with an infected person. Venereal disease can cause serious illness. Childless homes. Abnormal children. Syphilis and gonorrhea are contagious. Common. Curable. Medical science has made this last statement possible. Research is constantly improving treatment and speeding up cure. If we cooperate with health authorities, if we have a real understanding of the problem, and if we keep up a high moral standard, gonorrhea and syphilis will be wiped out.